Hello, I'm Amari Jones and welcome to Caffeine TV, your daily video news brief, here to take you through 3 headline numbers in just 3 minutes, giving you a different take on everything from housing policy to the Real Housewives. The first number up today is 98.6. That's the temperature that nurse Casey Hickox, yep, that's her name, had when she was tossed into a plastic tent this weekend and sealed away with no shower and no working toilet under Ebola quarantine orders issued by the governors of New York and New Jersey. And they've issued those orders for healthcare workers who treated Ebola patients who are coming back to the United States on international flights, landing at airports in their states. And they've done so out of frustration with the fact that healthcare workers like Dr. Nancy Schneiderman and Dr. Spencer didn't self-isolate for the full 21-day Ebola incubation period, which means they could possibly cause a public health crisis, and out of fear that the CDC, well, doesn't know what they are talking about. Now, 98.6 is not a fever, and in fact, Nurse Hickox has tested twice negatively for Ebola, but facts don't seem to be at work here because, as a matter of fact, quarantines are, well, stupid. One of the things that helped to fuel the Ebola crisis in Liberia is the fact that they issued a quarantine, and quarantines mean that people who have symptoms don't want to show up because they don't want to be locked away, and plus quarantines can be avoided. I mean, what if Nurse Hickox had flown to Thailand for a week and laid out on a beach before coming back to the United States? No one would be none the wiser. So instead of issuing these blanket policies that are designed to make us feel safer when in fact they make us less safe, how about formulating policies that are based on facts, not fear? But hey, maybe that's too much like sense. The next number up today is 2,189. That's the number of U.S. troops that have been lost in the 13 years of war in Afghanistan, according to the Cost of War Project at Brown University. Now, the good news is that yesterday, Sunday, combat operations for U.S. soldiers there came to an end, but there's a question of whether or not our exit really is an exit. The government there is shaky and the Taliban is itching to come back into power. And as the U.S. campaign against ISIS in Iraq shows, when it comes to efforts that we have there, is over really over? I mean, they seem to go on and on like those Scream movies. What are we up to, like Scream 189? The next number up today is 150,000. Now, according to The Guardian, that's the number of men in the U.S. each year who get vasectomies, an all-time high. Never been higher. And we always talk about the reproductive rights of women, but it seems like men are now grabbing control and embracing their own reproductive rights, which is a good thing. But one of the reasons why is because of the economy. It costs $250,000 each year to raise a kid, and the lack of jobs has driven the U.S. fertility rate to its lowest on record. And so what that means is that the next time you're at the restaurant with the one you think is the one, you need to add to that whole list of questions that you have whether or not he's cut the cord, because there's a good chance that he's already been snipped.